Welcome to our presentation, Caring for Children and Youth with Complex Care Needs in New Brunswick during the COVID-19 pandemic. This study was conducted by the Center for Research in Integrated Care at UNB St. John. The purpose of this study was to explore the impact of the COVID pandemic on caregivers and care providers of children and youth with complex care needs in New Brunswick. Children and youth with complex care needs typically need more support than their peers due to underlying illnesses or conditions that they have. Caring for these children and youth can present some challenges in the best of times, let alone when we're in the middle of a pandemic. So we distributed an online survey to caregivers and care providers of children and youth with complex care needs. It assessed how caregivers and care providers are coping with the pandemic, what their services needs are, and similar issues. We ended up recruiting 45 caregivers and 7 care providers. Note that the sample was largely female, so keep that in mind. In terms of results, we'll start by looking at some quantitative data on caregiver mental health symptoms. As you might expect, caregivers reported a significant increase in depression since the pandemic started. There's been an increase in anxiety since the pandemic started as well. Ratings tended to be a bit higher for anxiety than they were for depression. And the results for stress mirrored the results for anxiety quite closely. Now let's look at some qualitative data from our sample. Caregivers reported a general lack of support for their families during the pandemic. Many reported a transition to virtual-only services, whereas others reported a reduction in or complete loss of services. Caregivers reported that keeping schools open or increasing school support would be most helpful when caring for their children during the pandemic. They also reported the need for mental health supports and respite support for their families during lockdowns. Care providers reported the biggest challenge for them is balancing everyone's safety with administering quality care to these families. Care providers also mentioned that the COVID-19 pandemic and resulting lockdowns impacted the mental health of the families for whom they provide care. These providers expressed a need for increased mental health supports for caregivers and their families. Overall, caregivers of children and youth with complex care needs are experiencing major challenges during the pandemic, and care providers recognize these challenges. There is a need to improve support and services for caregivers and care providers during periods of strain on the healthcare system and extended social isolation.